Today we're going to talk about the heart, the fetal heart. So these are some notes that I put together over the years that are just pretty straightforward and start to kind of discuss the cardiac chambers and anatomy of the heart. So the heart occupies the central portion of the thoracic cavity in the middle mediastinum. 1/3 of the heart is located on the right side, and 2/3 of the heart are located on the left side. The heart in the fetus lies horizontal in the thorax, and a four-chamber view plane of the fetal heart is obtained in almost the same plane as the transverse plane of the chest. So whenever you're looking at the chest and doing a transverse view of the chest, it's pretty easy to just pick out that four-chamber heart. The right and left lungs fill the majority of the thoracic cavity, with the heart occupying the central portion. So the echogenicity here and here, those are the lungs. The right atrium, which is right here. So this is like in our four-chamber heart view, transverse view, occupies the right anterior position within the heart, and the right atrial appendage, which is difficult to see on ultrasound, is well recognized as it shows a broad triangular or pyramidal shape. Unless it's very prominent, that's very difficult to see. The right ventricle is right here and is positioned anteriorly and occupies the majority of the anterior surface of the heart. The right ventricle is the most anterior cardiac chamber. So anytime that you are trying to distinguish the ventricles, which one's which, I always think the one that's closest to the chest wall is always the right ventricle. The pulmonary artery emerges from the right ventricle, which will be, we'll have some images of that later on, and crosses over the aorta. The left ventricle is more like conical shape, and it occupies the posterior surface of the heart. And the left atrium, which receives blood from the pulmonary veins, is the most posterior cardiac chamber. So these little areas here that you can see coming off the left atrium, those are pulmonary veins. And that's one way you can distinguish the left atrium. The aorta angles anteriorly and points towards the fetal right shoulder as it exits the left ventricle. So as we scan through the heart, we're going to see the aorta come off the left ventricle here. The left ventricle really does contribute mostly to the apex of the heart because it just appears longer. Here's another image of it that I took from one of our books. So this is the right ventricle. This little band right there is the moderator band in the right atrium. The valve that is the tricuspid valve right here, right atrium, left atrium with the pulmonary veins coming in, the mitral valve, and the left ventricle. So let's talk about the right atrium a little bit more. It's located anteriorly and to the right of the left atrium, and it receives blood from the SVC and IVC. So that's going to be one of its characteristics that I want you to know. It contains the sinoatrial and atrial AV nodes, which help the conduction of the heart. And again, there is an appendage. It's difficult to see on ultrasound, however. Now, the tricuspid valve prevents the blood from flowing back into the right atrium from the right ventricle during ventricular systole. It has 3 leaflets. That's its defining little thing. The anterior, septal, and posterior, and the tricuspid valve inserts more apically. That's another thing I want you to know. Apically means towards the apex of the heart than the mitral valve. So that's another thing. You can see that it's just a little bit lower than the mitral valve. The right ventricle is closest to the anterior chest wall. It has like a little band here called the moderator band. That's another distinguishing factor for the right ventricle. The right ventricle is what is always associated with the tricuspid valve. So those two always go together. And it seems like it has more papillary muscles than the left ventricle. It's not as smooth as the left ventricle. So the left atrium is posterior located over the spine. So it's the most posterior chip. So it's closest to the spine here. It receives 4 pulmonary veins, but yet those are very hard to see on ultrasound, all 4 of them. We like to at least get 2. And it also has a left atrial appendage, but again, difficult to see on ultrasound. The mitral valve prevents the blood from flowing back into the left atrium from the left ventricle during ventricle systole. And this one is always associated with the left ventricle. The mitral valve only has 2 leaflets. So that's different than the tricuspid. The left ventricle is conical in shape and has no moderator band and close anatomical relationship of inlet and outlet. So the mitral valve and the aorta or aortic valve are really close together. You can't see that because this is like a 2D image of the heart. But as you scan through the heart, you'll see that the left ventricle, the aorta comes off the left ventricle, and the or aortic valve is very close to left ventricle. So the ventricles are separated by a ventricular septum here. That's that line. And the 2 atrias are separated by the interatrial septal. But if you can see, there's a hole here. And we want that in fetal life. It's called the foramen ovale. And it beats from right to left. It's located in the left atrium, and it allows oxygenated blood to pass over so that the oxygenated blood can get to the aorta and to organs faster and not go through the lungs, because they don't need to go through the lungs in fetal life. Now, the foramen ovale closes after the baby is born. So this is our pulmonary artery. It arises from the right ventricle. So if we scan a little bit further up towards baby's head, we'll see this right pulmonary artery coming across the right ventricle here. This is more like a short axis view of the heart. The pulmonary artery crosses over the aorta and divides into right and left pulmonary arteries, because that's another distinguishing factor. It splits. And the ductus arteriosus, which is another little passageway in the fetus that allows blood to oxygenated blood to keep going through the body without having to go through the lungs. It's connected to the pulmonary artery at this time. Now it closes again after fetal life. Here's the aorta coming off the central portion of the heart. So the aorta is divided into 4 segments: the ascending aorta, the transverse aorta, the thoracic aorta, and the abdominal aorta. And the ascending aorta arises from the left ventricle in the central portion. It angles anteriorly, pointing towards the left fetal right shoulder. And we always like to see these little branches. So these branches, if you remember from your anatomy, and the brachiocephalic, left common carotid, left subclavian. The SVC and the IVC enter the right atrium, and the pulmonary veins enter the left atrium. So those are going to be the veins that you want to know. So the first thing I like to do is determine fetal situs. And when we talk about fetal situs, that means just determining if everything's in the correct position. Is the stomach on the left side? Is the heart pointing towards the left side? Is it about 45 degrees? I think Most hearts lie 45 degrees. They can maybe lay a little bit different, but anything greater than 65 degrees or less than 25 degrees is abnormal. Dextrocardia, when the heart is on the right side, is located. Dextrocardia means that it's on the right chest, and mesocardia means it's more in the central chest. If it's really, really over on the left side, it's called levocardia. We like to start with the four-chamber view because it's considered one of the most important planes to be imaged during the fetal cardiac scan, because you can see a lot of different defects just from the four-chamber view. And this is it again. This is a great four-chamber view. This is what you want to see. So the first thing I'll do is I'll get a fetal abdomen, a transverse fetal abdomen. I'll see the stomach, and then I'll scan up towards the fetal head, and the four-chamber heart will just pretty much most of the time show up there. So the reason I do that, I'll take a cine of that, just showing that the stomach and the heart are on the correct side. So when I'm looking, then I go up to my four-chamber heart. I want to see a normal sized heart. So a normal sized heart occupies about 1/3 of the chest. I want to see the aorta in front of the spine on the left side. I want to see the apex of the heart pointing 45 degrees. The atrium are equal in size. I want to see the foramen ovale in the middle. At least 2 pulmonary veins I want to see. I want to make sure that both the tricuspid and mitral valves are opening. I like to see that the tricuspid valve is more apically placed, which means just a little bit lower or towards the chest wall. Both ventricles need to be equal in size and contract. A big one here is that the ventricular septum is intact. This is when you get the holes in the heart are mostly in the ventricular septum. And I like to see the moderator band on the right ventricle. After I look at the four-chamber heart, I'll go to a short axis view. So just turning the probe 90 degrees from a four-chamber heart will usually get you the short axis view. And here I can evaluate the pulmonary artery, its bifurcation. I can see the aorta here. The other thing I like to do is from a four-chamber heart, I'll just kind of tilt the probe in a medial aspect towards the direction of the fetal head, and I'll open up the left ventricle, and that will show me the aorta coming from the left ventricle here. This is called the 5-chamber view because the aortic outflow, which is this area here, accounts for the 5th component. Here we are again. So this is just angling the probe just a little bit from a four-chamber view, opening up that left ventricle, and you will be able to see the aorta there. This is both showing the left ventricle. It's just showing it in a different plane depending on how the baby's laying in there. This, the spine's up. This, the baby's laying probably more with the spine on the maternal left, or yes, maternal left. Once I've done the four-chamber heart, I've looked at both of the outflow tracts, I'll scan up a little bit further up towards the upper fetal thorax, and the 3-vessel view that demonstrates the pulmonary trunk should come into, and seeing those 3 vessels together really rules out most congenital heart defects. So this is just further up in the chest. You'll see the pulmonary artery, the aorta, and the SVC here. And you want to see them kind of just exactly like this. The pulmonary artery long, the aorta just a little bit further behind in the SVC. The inflow and outflow can be seen in the same plane and are typically almost perpendicular in orientation. So what that means is the pulmonary artery here and then the aorta, they're basically perpendicular. After I do a short axis, I look at the outflow tracts. I'll go to the sagittal view to look at the IVC, the aorta, and the ductal arch. The aortic arch view is very beautiful. If you can get it, it's like what we like to say a candy cane, and you'll see those 3 branches come off. I always like to obtain that view. See the aorta coming off the central portion, looks like a candy cane. The ductal arch view can be imaged by sliding the transducer further to the left from the aortic view, and it comes out more like a hockey stick. So it arises from the anterior portion of the heart, more from the right ventricle. And it looks more like a hockey stick. It's longer here. This is the ductus arteriosus that is connecting it to the aorta right now. That closes up after baby is born. All right, that's it for today. Thanks.